Good day. My name is Rakeo Cox, and today I'm going to be talking about my modality, diathermy. And I'm going to talk about the contraindications, the indications, and how it should be set up. Diathermy is a controlled production of deep heat beneath the skin in the subcutaneous tissues, deep muscles, and joints for therapeutic purposes. Well, since I won't be able to actually show you on a patient because I don't have a diathermy, I'm going to describe how it should be used. The first important thing is to let the patient move all jewelry, metal, and cell phone, because a diathermy is an electromodality, and if the patient leaves the jewelry on, they will produce hot spots and possibly burning in the skin. The diathermy is not really a difficult modality to use. The most important part is to set up the patient in a comfortable position, because the patient have to be in this position the entire process. Let's say that we're doing a treatment on the lower back. We have to place the patient in a prone position and place some sort of support underneath the front part of the hips. This will keep the spine in a neutral position, making sure that the patient is in a comfortable position before setting up the modality. Then, here will you inspect the areas to be treated for rash or open wounds. Then you'll need to place a towel over the area of the lower back to prevent any burning, so that the moisture coming from the skin is absorbed in the towel. The modality is a good modality when treating bigger areas, and to do a deep heating at the same time can be used. At the same time, it can be used. Ultrasound can be used, but it's not going to give the full effect as the diathermy, which is a bigger, and it treats it and it produces a deeper heat. First, you have to place the electrode drum to the exact treated area that has to be, and it has to be touching the towel, or else the heat will spread throughout the room. So for you to put it on the exact area so that it could get the full effect, you then turn on the unit. But most units will come set up exactly already. But in case you'll need to set up the pulse duration, pulse frequency, such as the most common 27.12 megahertz. Adjust the intensity and set the required treatment time, usually 15 to 30 minutes. Then you will press the start button. Then you're going to periodically check back with the patient to see if the heating is too vigorous. When the timer shuts off, terminate the treatment, assess the treatment efficiency, and record treatment parameters. Well, the indications for this diathermy are basically: don't treat over open wounds, people with pacemakers, metal implants, pregnancy over like testes or uterus, rashes or cancer, and even deep X-ray therapy in the last 6 months. Well, once again, my name is Rakeo Cox, and this is the full explanation of a diathermy.
Sit down. Alright. As you see here, we have a free bag. No back support here. This free bag for the use of shortwave diathermy. Okay. We'll make the arm free again. Then lower the arm for the back. As you see, then adjust and fix the arm again. Alright. Choose again continuous or interrupted. Type of electrode. Time. Okay. Then increase the intensity. Alright. So this is another position for the application of shortwave diathermy over the back from sitting position, because sometimes, especially if it is obese patient, they always don't prefer the bone line position. It makes him a shortness of breath. So it is better to make him sitting as on a chair, as we see, and apply the shortwave diathermy over the back. All right. We'll assume that we have finished the session, and we'll choose another area of application to apply shortwave diathermy over it. Okay. Again, we'll make the arm upright position. Always, when you finish the application, make the arm in upright position in order not to make it loose and maybe fall down. All right. Plus.